If Losartan is part of your daily routine right now, whether it is the first tablet you take in the morning or the one you set out the night before so you do not forget, there are 5 specific things that quietly work against it. And at least one of them is something most people on Losartan do every single week without any awareness that it is a problem. This is not about the medication failing. Losartan is one of the most widely prescribed blood pressure medications in the world, and for good reason. It works, but how well it works and how safely depends on 5 things that were almost certainly never covered in the appointment where it was prescribed to you. Not because your doctor made a mistake, because the appointment that covered your dose, your diagnosis, and your refill schedule had no time left for the conversation that actually protects you. What did not get covered is what happens when Losartan meets a specific type of fruit, a common painkiller, a supplement sitting in your medicine cabinet, a habit around salt, and a decision most people make quietly at home when a side effect becomes uncomfortable. Each of those 5 things, on its own, sounds completely ordinary. Together they account for a significant portion of the Losartan-related complications that show up in adults over 60 years. Most of them preventable, almost none of them ever linked back to these 5 causes by the people experiencing them. My name is Dr. Joseph Collins. I'm a medical health educator. And before we go any further, do not stop, reduce or adjust your Losartan dose based on anything in this video without speaking to your prescribing doctor first. What I'm about to share is information designed to make your next appointment more productive, not a set of decisions to make on your own at home. Here is what I'm going to do. I'm going to walk you through all 5 things, the mechanism behind each one, why it matters specifically for Losartan, and what to do instead. Stay with me through all 5, because the 5th one loops directly back to the first 4 in a way that changes how you understand all of them. That connection is the part most people never hear explained. Before we get into them, I want to tell you about a woman I will call Dorothy. She was 71, a retired schoolteacher, someone who took her health seriously and followed her routines carefully. She had been on Losartan for just over 14 months. Over the course of a single week, 3 things happened that seemed completely unrelated to her blood pressure medication. She did not connect them. Neither did the people around her. By the time she came in to see me, those 3 things together had produced a potassium level and a blood pressure reading that had her frightened, Hamati, and a trip to the emergency department that, looking back, was entirely avoidable. We will come back to Dorothy. Her story runs through this entire video, and by the end of it, you will understand exactly how 3 ordinary, well-intentioned decisions stacked against each other in the space of 1 week. Now, before I go through the 5 things, I want you to notice something as we go. None of them will sound alarming at first. A piece of fruit, a painkiller from the bottom drawer, a supplement someone recommended at church, a habit at the dinner table, a quiet decision made at home. That is precisely why they matter. Nothing about any of them triggers the caution that a person would naturally apply to something that felt risky. They all feel responsible. Some of them even feel healthy. That ordinariness is exactly what makes them dangerous for someone on Losartan specifically, because Losartan works through a mechanism that makes it more sensitive to these 5 disruptions than most people realise, and more sensitive than most other blood pressure medications in the same category. Give me your full attention through all 5. By the time we reach the end, I believe you will look at some very ordinary parts of your day very differently. Thing 1. Potassium-rich foods taken in excess. Losartan belongs to a class of medications called ARBs, angiotensin receptor blockers. Its primary job is to block the action of a hormone called angiotensin II, which causes blood vessels to constrict and signals the kidneys to retain sodium. By blocking that signal, Losartan relaxes the blood vessels and helps the kidneys release excess fluid. But Losartan also has a secondary effect that is rarely explained at the point of prescription. It causes the kidneys to retain potassium. In most people on a normal diet, this is not a problem. The kidneys manage the balance. But when someone on Losartan begins significantly increasing their potassium intake through foods they have been told are heart healthy, or through supplements added to their routine, the kidneys can struggle to clear the excess. Potassium levels in the blood can climb above the safe range without producing obvious symptoms until they reach a point where the heart notices. Think of it this way. Losartan turns down the dial on potassium leaving the body. That is fine at a normal dietary level. But if the amount of potassium coming in increases significantly at the same time, the dial that has been turned down cannot compensate. The result is a slow, quiet accumulation. Not something you feel on a Tuesday, but something that shows up in a blood test or, in more serious cases, as heart rhythm changes that seem to come from nowhere. The foods most commonly involved are not junk food. They are bananas, avocados, spinach, oranges, potatoes, and certain meal replacement shakes and sports drinks marketed specifically as healthy choices. What to do instead? You do not need to eliminate these foods. That is not the message. The message is that moderation matters more on Losartan than it does for someone not taking this medication. If you have recently added a potassium supplement, a green powder, or a daily banana and spinach smoothie to your routine, mention it specifically at your next appointment. Not as an afterthought, but as the main item. Ask your doctor to check your potassium level if it has not been checked in the last 6 months. That single conversation could prevent the kind of result Dorothy walked in with. We will get to that shortly. Thing 2. NSAIDs taken regularly for joint pain or general aches. This is the one that lives in almost every medicine cabinet in the home of someone over 60. Ibuprofen, naproxen. The tablet reached for when the knees ache, the back tightens, or the hips make getting out of a chair an event. Taken occasionally, the risk is low. Taken regularly, meaning several times a week for weeks at a time. The interaction with Losartan becomes clinically significant in 2 separate directions at once. Here is how it works. Losartan lowers blood pressure partly by helping the kidneys release sodium and fluid. That process depends on specific signaling molecules called prostaglandins to keep the blood vessels feeding the kidneys open and responsive. NSAIDs work by suppressing prostaglandin production throughout the body. When prostaglandins are suppressed, the blood vessels feeding the kidneys tighten. The kidneys begin retaining more sodium and fluid than they otherwise would. That retained fluid pushes blood pressure upward, directly counteracting what Losartan is working to achieve. But there is a second problem that makes this worse specifically for Losartan users. Because Losartan already causes the kidneys to retain potassium, and NSAIDs also affect kidney handling of certain electrolytes, regular combined use creates the conditions for potassium to climb and kidney function to decline. Both quietly, both without obvious symptoms in the early stages. Think of it as 2 people pulling a rope in opposite directions. Losartan is pulling the blood pressure down through the kidneys. Regular NSAID use is pulling it back up through the same pathway. The person taking both regularly may find that their blood pressure readings have been creeping upward for weeks, and never once consider that the ibuprofen they have been taking for their knee is the reason their medication appears to be losing its effect. What to do instead? Paracetamol, also known as acetaminophen, does not carry this interaction and is the first-line alternative for pain management in adults on blood pressure medication. If you are managing a chronic joint condition that genuinely requires something stronger, that is a specific conversation for your doctor, not a decision to handle with whatever is at the back of the drawer. Topical NSAID gels applied directly to the affected joint are also worth asking about, as they deliver far lower levels into the bloodstream than an oral tablet does. Thing 3. Potassium-sparing supplements added without checking. This one overlaps with Thing 1 in mechanism, but arrives through a completely different door, and it catches people off guard precisely because the supplements involved are often recommended by well-meaning friends, family members, or health articles that have no way of knowing. The person reading them is on Losartan. The most common offenders are potassium supplements taken directly, but also magnesium-potassium combination products, certain herbal supplements including dandelion root and nettle leaf, and salt substitutes. Salt substitutes deserve particular attention here because they are actively marketed to people managing blood pressure and heart health, and many people on Losartan reach for them specifically because they are trying to do the right thing. What most salt substitute packaging does not state clearly is that the product replaces sodium with potassium chloride. For someone whose kidneys are already retaining potassium because of Losartan, adding potassium chloride to every meal is adding to a load the kidneys may already be managing at their limit. Dorothy's potassium level, when she came in, was elevated beyond the normal range. One of the 3 things that had happened that week was that a close friend had given her a container of a popular salt substitute, telling her it was safer for her heart. Dorothy had used it generously every day for 6 days. Combined with her Losartan and a potassium-rich diet she had adopted in recent months, the accumulation had moved her potassium into a range where her heart was beginning to feel it. Palpitations she had been quietly attributing to anxiety. Think of Losartan's effect on potassium like a slow drip filling a container. The container handles a normal drip without any issue. A salt substitute, used daily, generously, is like opening a second tap into the same container. The level rises faster than it would through either source alone. What to do instead? Before adding any supplement to your routine while on Losartan, even something marketed specifically for heart health or blood pressure, check with your pharmacist first, not next month. Before you open the container, a 2-minute phone call to a pharmacist is all it takes to confirm whether something is safe to add to a Losartan regimen. Your pharmacist will know. It is exactly the kind of question they are there to answer. Tell me in the comments right now. Have you ever added a supplement or switched to a salt substitute while on blood pressure medication without checking first? Type yes if yes, because thing 4 is the one that catches the most careful, most responsible people completely off guard. It has nothing to do with food or supplements. It operates through something most people consider entirely separate from their medication. And if this video is giving you something real to act on, tap subscribe. This information matters. 1 second is all it takes to make sure you do not lose this channel tomorrow morning. Thing 4. Dehydration. During heat, illness, or reduced fluid intake. This is the one that surprises people the most because it has no obvious connection to a blood pressure medication. No food, no supplement, no other tablet, just water. Or more precisely, the absence of enough of it at the right time. Here is why it matters specifically for Losartan. Losartan works by relaxing blood vessel walls and signalling the kidneys to release fluid. Under normal, well-hydrated conditions, that process is balanced and controlled. But when the body becomes dehydrated, through summer heat, a stomach illness that causes vomiting or diarrhea, a day of reduced eating and drinking, or simply not keeping up with fluid needs during warm weather, the kidneys shift into a conservation mode. They begin holding onto every drop of fluid and sodium they can retain. When Losartan is in the system at the same time, these two signals work against each other in a way that places unusual strain on the kidneys. The medication is signaling the kidneys to release fluid, the dehydrated body is signaling them to hold everything. Caught between those two opposing demands, kidney function can dip temporarily. And in adults over 60, where kidney reserve is already reduced compared to younger adults, that temporary dip can become a more significant event. The symptoms are easy to dismiss. Lightheadedness when standing. Fatigue that feels like a tired day rather than a warning. A headache that feels like it came from the heat. A blood pressure reading that swings unexpectedly low and then high within the same afternoon. These are the readings that come into an appointment with no clear explanation. Until someone asks about fluid intake over the past few days, and think of it this way, Losartan is a medication that works with the body's fluid system, not independently of it. When the fluid system is under stress, the medication does not pause, it continues doing what it was prescribed to do. In a body that no longer has the resources to manage that process safely, what to do instead? On hot days during illness or any time normal eating and drinking has been disrupted for more than a day, pay deliberate attention to fluid intake. If you are unwell and not keeping fluids down, contact your doctor's office specifically to ask how your Losartan should be managed during that period. Many prescribing doctors have a clear protocol for this, a temporary dose adjustment or a brief pause. But it requires a call, not a quiet decision made at home. This is not something to wait out and mention at the next routine appointment. The window where kidney strain accumulates is the same window where the intervention is simplest. Thing 5. Stopping Losartan without telling anyone because of a side effect. This is the one that ties directly back to things 1, 2, 3, and 4. And it is the single most common Losartan-related decision I see adults making on their own, in private, with the best of intentions, and without understanding what comes next. The most common side effect that drives people to stop Losartan quietly is dizziness. Not the dramatic kind, not falling or losing consciousness, but a persistent low-level dizziness, particularly on standing, that becomes tiring to manage and easy to blame on the medication. The second most common is a dry, persistent cough. Though this is more frequently associated with ACE inhibitors, a related class, it does occur with ARBs, including Losartan, in a smaller proportion of people. The third is a general sense of fatigue or flatness that the person attributes to the medication without being certain. What happens when Losartan is stopped abruptly is not a simple return to the blood pressure level that existed before starting the medication. The cardiovascular system has been operating under the influence of Losartan. Relaxed vessel walls, adjusted fluid handling, a specific hormonal balance maintained by the angiotensin receptor blockade. Remove that abruptly, and the system does not immediately recalibrate to its original state. In a proportion of people, particularly those with established cardiovascular disease or long-term hypertension, blood pressure can rebound above the pre-treatment baseline within days of stopping. That rebound carries real risk, stroke risk, cardiac event risk, during a window when the person believes they are simply taking a break from a tablet that was bothering them. This is what completed Dorothy's story. The third thing that happened during that week was that she had been feeling persistently dizzy in the mornings. She stopped her Losartan 4 days before she came in, planning to mention it at her upcoming appointment. By the time she arrived, her blood pressure was significantly above anything recorded in the 14 months she had been on the medication. The elevated potassium from the salt substitute, the rebound from stopping Losartan, both happening simultaneously, neither visible, both entirely avoidable. She told me something that has stayed with me. She said, "I thought I was being sensible. The dizziness was real, and I thought giving my body a rest was the careful thing to do. Nobody ever told me that stopping was the part that wasn't safe." Nobody told her. That is the thread running through every single one of these 5 things. What to do instead? If a side effect from Losartan is affecting your quality of life, dizziness, fatigue, anything that is changing how you move through your day, call your doctor's office this week. Not at the next routine appointment. This week. Describe exactly what you are experiencing and when. There are dose adjustments, timing changes, and alternative medications within the same class that address these side effects without requiring you to stop the medication and absorb the rebound risk alone. 5 things. A potassium-rich food added to a heart-healthy routine, a painkiller from the back of the drawer, a salt substitute passed along by a friend, a hot week with not enough water, a quiet decision to stop because a side effect became too much to manage alone. None of these 5 things look like a medical event in the moment. Each one is the kind of ordinary choice an adult makes without a second thought. Because nobody explained that on Losartan, these 5 specific things are no longer ordinary. Losartan works every single day it is in your system. These 5 things are the 5 ways that daily work gets interrupted without anyone realizing it, until the interruption becomes something you can feel. Now you know all 5. One final thing. If you are scheduled for any procedure, including dental work that involves fasting or changes to your normal routine, ask your doctor specifically how your Losartan should be managed on that day. Fasting affects hydration. Combined with Losartan's fluid effects, it can intensify the dizziness described in Thing 4. A brief conversation before the appointment prevents a problem during it. Ask before the day, not on the day. Which of these 5 things was new to you today? Tell me in the comments. I read every response. Share this with someone you know who is on Losartan, especially if they have been feeling dizzy in the mornings and haven't mentioned it to their doctor yet, or if they have been using a salt substitute thinking it was the safer choice. That person needs to see this video before their next appointment, not after. This is Dr. Joseph Collins. 5 ordinary things. 1 medication. Now you know all 5. I will see you in the next one.